Hello, my name is Linda Anthony, and we want to welcome you to this episode of GPS focused on ending the institutional bias of our long-term care system in Pennsylvania. I'd like to start by explaining a little bit of what that institutional bias is. We're here today to talk about the struggle that people are going through in ending that institutional bias once and for all. Few Americans know that the only thing they are entitled to is the right to care in a nursing home or other institution. And what we're here about today is to talk about there are alternatives to people going into nursing homes, and we are here to talk about those today. Even fewer people, though, in America know that there is different ways to live in the community, and there is also money to help them live in the community. We know right now that we can serve 3 people in the community to every one that's in a nursing home. What happens when someone goes into a nursing home is the family's money starts depleting their savings, their retirement funds, until Medicaid starts paying for the nursing home or institution. The institutional bias actually began when Medicaid started paying for assistance for people in nursing homes. That institutional bias remains today, and even though 95% of Americans say they want to be in their own homes, we still are putting people in nursing homes and other institutions, and that is not where they want to be. Children with disabilities are in nursing facilities in Pennsylvania. Veterans who stood up for the very freedoms we're talking about here today are stuck in nursing homes. That is not where they want to be. As taxpayers, we have to start asking ourselves the question, if so many people don't want to go into nursing homes and other institutions, then why are we still paying for the higher price ticket of a nursing home? Knowing that we can serve 3 in the community, why, as taxpayers, aren't we asking why is that not happening? Some people think it is not so bad to be in an institution or cannot believe the atrocities that happen when no one is looking or even listening. Jeannie Searle, one of our panelists, is a former resident of an institution, and she fought and won her way out of that institution 30 years ago. For the past 21 years, she's been working as a policy advocate for the Disability Rights Network of Pennsylvania, and she has her own apartment. She has come from someone who is using tax dollars in an institution to now paying taxes like the rest of us. Jeannie, would you mind telling us what it was like to be in the institution, to explain to people why it's like incarceration?
In the institution everybody was there with a disability or some kind of disability, and they were strict with rules. So you had to follow the rules every time something happened. So, for example, if somebody got punished, what they would do is they would put them in a corner and have their hands tied behind their backs, and they would stay there for an hour, 2 hours, 3 hours. It all depends on what the director or the supervisor or the staff person that was working, it was their rules. And if you didn't follow the rules correctly, then you got punished really, really bad. It was like living in a prison cell.
How long did it take you to get out of the institution?
I got out of the institution. It took me almost 21 years to get out of the institution.
I think one of the other things that you've been a very big advocate for is nothing about us without us. Can you tell us a little bit about that?
What I've been doing for the past 21 years is I've been fighting for everybody with a disability to get out of the institution. I've been to the White House, I've been to the Capitol in Harrisburg, I've been to the Rotunda, I've been all over talking about how important it is for people with disabilities to be out of the institution. I don't think they should be there. I think they have every right to live the life the way they want to, but I don't think being in the institution is the proper way for them to live their life.
Thank you for that, Junie, and thank you for the work you've been doing.
Thank you.
Norma, you are also someone who was in an institution and you fought your way back into the community. Once you've returned to the community now, you're a homeowner, you are working full-time as a nursing home transition, getting other people with disabilities out of nursing homes. You are very involved in the lives of your godchildren. So can you tell us a little bit about, you're someone who moves people now out of nursing homes. Can you tell us a little bit about that transition process? How long does it take to move someone out? Is it difficult?
Yes, currently now I would say, depending on each person's situation, it can take up to 6 months for someone who's currently in a nursing home. Before they would have providers that would be able to work with consumers. Currently now they have a different agency which the state contracts with that agency, and that slows the process down. So you're dealing with a couple of agencies. You're dealing with the agency which is called Maximus, the independent enrollment broker. That's the initial intake. They go out and meet with the consumers in a nursing home, and then they refer them to the area of aging, which has to go out to do an assessment. And then the process continues with the enrollment broker, which is Maximus, sending their information to the state, which has to approve the process. And then once the state approves that process, the supports coordinating agency that the consumer chooses to coordinate the services in the community has to go out and meet with the consumer. So you're dealing with maybe 5 or 6 different people with the process of trying to get somebody out the nursing home, along with identifying housing. I mean, housing is a barrier for everyone.
Yes. You've been doing this quite a while. Do you have any thoughts of what could be done, at least initially, to speed the process up? 6 months is a very long time to wait to get services. So do you have any ideas or where the barriers lie, the greatest barriers other than housing?
I think if they go back to initial process with having the supports coordinating agency remove the contractor, which was Maximus, doing it, that would help with the process. Okay. Start back with the supports coordinator going out to meet with the consumer. And then again, they wouldn't have all these different people involved with the process.
And so if someone is looking to get out of a nursing home or prevent from going into a nursing home, they can contact you at Liberty Resources?
Yes, contact our intake department.
All right, thank you. Our next guest I want to introduce is Estelle Richmond. Estelle, is the former secretary of the Pennsylvania Department of Public Welfare, the former chief operating officer of HUD, the Housing and Urban Development in Washington, D.C., and a former commissioner of health for the city of Philadelphia. Estelle, you have been someone who has been a very strong supporter of home and community-based services. You've initiated programs that help people to get out of those nursing homes, to help people like Norma do the job of getting them out. Can you tell us, in your words, what you believe is probably one of the biggest and hardest barriers we face?
Well, let me start by thanking Norma and Jean for sharing their stories, because I think it's very clear that people who have choice don't choose nursing homes to live in. I think the other challenge is understanding that the institutional bias is actually a federal problem. And the nature of the federal problem is that nursing homes are an entitlement, and home and community services are not. The key is not how to get people out of nursing homes, although that comes into it. Our real challenge is how to keep people from going into nursing homes. Too many people are either put into nursing homes or sent to nursing homes or have a fairly short illness, go into a nursing home and find it a hard time getting back out again. So our challenge is really looking at how we can provide the services someone needs to live in the community without going through the nursing home first. And there are several alternatives. I think, as Linda said in the beginning, we actually have alternatives. And I think the alternatives lie with the states. While the problem lies with the federal government, the alternatives are choices that states have in terms of how to rebalance our long-term care system. And rebalancing means that you at least get to a point where you have 50% of the people living in the community. At this point in time, in states like Pennsylvania, and probably most states, there are a few who have achieved that 50% balance or better, but we are probably somewhere in 20% of the people living in the community, and 80% of the people still in institutions. And by institutions, I mean it could be a nursing facility, it could be a mental retardation center, it could be a state hospital, or it could be anything else that holds you there because it's of the entitlement that nursing homes have. Some of the alternatives. The first one I would bring up is the Supreme Court Olmstead Act, in which the Supreme Court said everybody has a right to care in the community and not to be placed in an institution. We are 14 years into Olmstead, and we still don't have what most people would say free choice from being in an institution. So the states need to observe Olmstead. The federal government has to push harder to enforce the Olmstead solutions. Second are community first options, which are essentially saying that before someone goes into a nursing home, you explore all the community options first. And you work hard. And this is an option, which means that any state can apply to the federal government to have this option. It brings with it additional funds. It brings with it a higher federal financial participation rate. So it can be very lucrative to the states to choose this option. Slowly, the states are getting there. Again, many of us are concerned as the baby boomers get older, states may option to build more nursing facilities than have the option of building more community services. So it becomes critically important to be able for states to be able to get this option. The third one is just more housing options. I think Norma mentioned the barrier for so many people is having safe, affordable, accessible housing. So hopefully we will be able to, I've worked with HUD and I've worked with several other entities about how do we get better housing, affordable housing, and accessible housing, and enough volume that people don't have to be worried about being put in a nursing home because their housing is not available. So those are some of the options. I'm sure there's more creativity that we could have in building even additional ones, but those are three options that states have to be able to minimize people going in. If we minimize people going out and focus on getting folks out of the nursing facility, we can solve this problem. And we can make sure that Pennsylvania is one of those states at 50-50 and hopefully reverse it so we have only 20% of the people who may, of their own choice, choose a nursing facility and everyone else in home and community services.
Great, thank you. One of the things I want to talk about is the fact that here in the city of Philadelphia, the city owns a nursing home, 450 residents. The nursing home, or the city of Philadelphia, is the administrator of the nursing home. Estelle, I know that we have tried to close that nursing home for many, many years to give those people the freedom they deserve. But can you tell us a little bit about the whole situation with the Philadelphia nursing home?
Actually, the Philadelphia, many years ago, probably close to 20 years ago, maybe not quite that long, subcontracted, or basically was their first outsourcing, and has the Episcopal Long-Term Care, I think that's what they're still called, that actually administrate and operate the nursing home, and the city provides a subsidy to that. So while the city doesn't operate it directly, they still hold the city as a license, so the city has the operating license, but it's run by a, quote, a third party. Very frankly, cities and states don't do well running institutions.
Correct.
In any manner, they are a challenge. But we've worked, as you said, and I joined that work, and we've had many studies, and the effort has been to try to significantly downsize the Philadelphia nursing home. It actually has a capacity of 500. We were able to reduce it to 450 and had plans of hoping reducing it to somewhere in the 200 range, which has not happened over the last close to 16, 20 years now. I think my hope is that our new mayor, who takes office in January, will look at this as an opportunity and begin to seriously downsize the nursing home and invest in alternative housing options for people who want to live independently with supports, and those supports come from the state. So it really isn't the city by itself, it's the city working with the state, but certainly people use, many of the people in the nursing home, if not a majority of them, if they had options, would choose other options.
Right. Like I said earlier, we know that 95% of Americans don't want to go to a nursing home. Right. Yet we are still not, we have community first option, which is something that the state of Pennsylvania could adopt in its state plan, and then people would have that right to the community. We don't have that right now.
I hope that this new administration, certainly our new governor, Governor Wolf, has committed to looking at other options and to apply for options like this and look at other ways of decreasing, in this case, the burden of long-term care on the state. As you said, no one wants to go there, but it's where we spend the largest proportion of Medicaid dollars. Exactly. Does it make sense?
And as we said earlier, the Medicaid is the payment of Medicaid for long-term services is what really created the institutional bias. I guess what I want to ask, some of the things that people could do to make this better, to correct the problem, to reach our goal of rebalancing the system to at least provide people with choices of where their long-term care dollars are spent. We have community first option. We have different ways that people could all get out now and will be in the future. So because we have all these things and we know 95% of people don't want to be there, and we know that we're serving 3 people in the community to 1 in the institution, what do you still see as the barrier why it's just not happening?
I don't think enough people know about it. I think people like Jean and Nora, you, all telling the story of why this isn't where they want to live and why this isn't acceptable. I also think it's partly my generation who think that's our only option, and we do things like, I want to not burden my children, so I'll go into the nursing home so someone else will take care of me and my children don't have to. I think it's also us communicating to our children that that's not where I want to be, and what can we think of now? So when I reach a point that I might need additional help, what are the other resources? Because children then, children who are probably my children's age, which are in the 40s, are thinking, well, I have a safety issue. This issue of safety and security is one that children and families think of a lot and say, I better put mom there so I don't have to worry about her. I also think that's not what mom wants, but no one asks mom sometimes.
Correct.
My grandmother lived independently until she was 106. And basically, while it takes a neighborhood to work with a child, so with someone that senior. The people around her looked in on her. They took her to church. They helped her. They took her to buy her groceries. You can live independently, as many people know, with a little support.
Yes, and we've shown that over and over, just by the people here that are at this table.
But somebody needs to know about it, we need to talk about it. Forums like this can make a tremendous amount of difference.
I think people understanding this issue is very important because it's really not just an issue that's about people with disabilities. because the only right we have right now is to go into a nursing home, when something happens, I acquired my disability, I wasn't born with it. Sometimes if you don't have the help at home, or you don't have someone at home who can actually do it because of their own physical limitations, you usually end up going into a nursing facility or other institutional setting. And that should not be anymore. People don't want to be there. Norma, can you tell us, like, in the process of moving people out of the nursing homes, have you experienced a resistance other than from the state? I mean, are families helpful in moving the person out of the nursing home?
Some are. Since we've been doing it for a while, like you said, families have noticed that the services that they're getting in the nursing home, so-called 24-hour, they're not getting 24-hour care. And by us going into the nursing homes more and meeting other consumers or residents in the nursing home, seeing other people moving out and services are available, that's helping. But like you said, we do need to get it out more. And I just want to go touch what you were saying about the things that for barriers. Living out in the community, you don't think, of your picture ID or your birth certificate, but these are barriers for people in the nursing home to move out. And if the state would give us funding to help, this would improve or increase the numbers of people who want to move out.
Okay.
And that's doable.
Yep.
And we've been doing it here in Pennsylvania with nursing home transition. We just have to do more. Jeannie, is there anything more that you can tell us or that you want to share with us about the institution and about the right to have the community? I mean, you're someone who was kind of stuck in there and without a say, and then you ended up fighting to get out. So do you have any words of wisdom to people out there who are trying to stay in the community in their own homes?
Well, the only thing that I want to say is that yes, it is a fight to get out. I have to say it is a fight, but it's doable. You could do it. It just takes time and a lot of hard work. What I want to say to people is that I know in my generation and anybody else's generation is that people are going back to the institution, and that shouldn't be happening. That should not be happening. What should be happening is that people should have a right to say, I don't want to be in the institution. I want to live in my own home, or I want to live with family, or I want to live with friends. They should have a right to choose where they want to live, and not say, well, because you're disabled or because you have a physical or mental or whatever disability that you can't make it on your own. I'm a pure example that I can and I did, and I'm still doing it. Mm-hmm. So what I would love to say is that just follow my steps, and you can do whatever you want as long as you put your heart and mind to it.
Freedom is a beautiful thing.
It is.
We want to leave people with a message about what they can do. I mean, if you want a better future for your children, even for yourself, when the time comes that you need help, you're only going to have the right to a nursing home. If you want to change that, if you want to make the future better for your children, your family, and your loved ones, you have to start talking about the fact that institutions are not good for people anymore. People want to be in the community. Baby boomers, we want to be in the community. I will not be locked up. We will continue to fight for the right to be out in the community. What you can do as citizens of Pennsylvania is talk to your legislator about the fact that you don't want to go to a nursing home one day. You don't want to have to put your loved ones in, and your children don't want to go to a nursing home. Talk about the fact that there is something available, the Community First option right now, that can pay for people to receive the assistance they need and never have to go into the nursing home. You need to talk it up in every chance you get. Because the general public doesn't really know a whole lot about the fact that they're entitled to a nursing home but nothing else. Educating the public about this situation is vital. They talk to their legislators And they explain why it's important for them to be in the community. And the very best advocate for people with disabilities, I believe, are people with disabilities. They must lead the charge. This is about civil rights. It's about freedom. It's about being able to get up late at night and have a cup of tea, read a book, watch television. These are all little freedoms that you don't realize you've lost until you're in there and it's not happening. What we want you to do is talk to your legislators, tell them about living in the community, how much more important it is. Talk to them about the fact that 3 people can be served in the community, and as a taxpayer, you want to know why the state of Pennsylvania is continuing to pay 3 times as much to have someone in an institution rather than provide them with the personal assistance and other things they need in the community at 1/3 the cost.
I would add to that, if there's one thing, and while this is so important to all phases of people with disability, it's also important to all of us who are seniors. Most of us don't want to be in a nursing facility ever, either. And you know, there's one thing I think we all know. I don't hear anyone, as I talk to large groups, saying, I want to die early so I don't get old. People tend to want to live long, healthy lives, which means the one thing we know in getting older is our skills become less. And at some point we may get sick. At some point we may need support. And at some point we may need help. So this affects all of us. You know, it's so easy sometimes to say it's only those people with disability. No, this is us. Yes. This is all of us, and this affects all of us.
But
Yes.
I also want to say on that is that even though we're physical and mentally disabled, we also would need somebody to make sure that our housing is very accessible for us to get in and out every single day, and make sure that we have accessible bathrooms or anything else that we need should be right there for us, instead of us going to an institution or to a nursing home to get the services that we need, that we could be getting in our house, instead of paying a lot of money for services that we could get inside the institution or a nursing home.
I want to thank all of you for coming today, and I want to thank you for your information and helping to educate people about this problem. As for the public, we are asking you to tell your legislators that you want community services for people, not nursing homes. Call City Hall, tell them that you believe the Philadelphia nursing homes should be closed and the city of Philadelphia needs to get out of the nursing home business. We want to see better use of our tax dollars by providing these community services so that we can serve 3 people in the community instead of just one in an institution. And that isn't where people want to be anymore. Those are old ways of doing things, and we don't want that anymore. So we ask that you spread the word about the fact that you and your loved ones don't want nursing homes, that you want to be in the community and you want the services that you need to be there to have a life. And again, I want to thank all our panelists. If you are someone who is seeking freedom, if you want to get out of a nursing home, you can call Liberty Resources. You can actually call Norma. Go ahead.
215-634-2000.
215-634-2000. That's a number you can call to get help, to get out of a nursing home, or to prevent from going in. You can also check for more information on the Community First option, you can go to the ADAPT website, www.adapt.org, ADAPT. That concludes our session for today. Believe that you are the best advocate to tell legislators what it is you want for the future. Help us end the institutional bias of the system. Help us to have our freedom as well.